Hi, today I'd like to talk to you about malaria in Sub-Saharan Africa. Every minute, a child in Africa dies of malaria. Malaria claims the lives of over 500,000 people every year. Its most susceptible victims are children under the age of 5 and pregnant women. This disease is spread by mosquitoes. Mosquitoes are considered annoying and pesky to many of us, but it's a bug that we rarely see as much of a threat. However, to the people of Sub-Saharan Africa, this bug is lethal. I've spent a large amount of time studying and researching this disease so that I can understand it better and help others understand it as well. The people of Sub-Saharan Africa are particularly plagued by this disease. However, this disease is preventable and curable, but the people have very limited access to the medications and preventive measures necessary to save their lives. Many people are working to fix this issue, but the progress has been slow, so there's much that still needs to be done. Malaria is a disease that needs the attention of the world. If it continues to go beneath the radar, millions of people will continue to die at heartbreaking rates. There's so much that each of us can do to help raise awareness. In order to do that, we need to understand this issue. So during this speech, I'd like to talk about the following points: the history of malaria, this disease's transmission and its symptoms, also how it's treated and prevented, and finally, what we can do to help raise awareness about it. Malaria has been affecting human and animal lives for over 4,000 years. It was originally believed that this disease was spread through the air, so that's how this disease got its name. Malaria literally means bad air. In the 1800s, it was discovered that malaria was actually spread by mosquitoes. Then in the 1900s, it was a hard time in the world's history. They were in an all-out malarial crisis. Millions of people were dying, and no one could figure out how to cure this disease. It wasn't until 1939 that some relief came in the form of an insecticide called DDT. This insecticide was used to eradicate malaria in the United States, Russia, and much of Europe and other parts of the world. But before it made its way to Africa, it was banned because of negative environmental effects it had. So the people of Africa were left to suffer with this disease, unfortunately. But you might be wondering, what happens when a person gets malaria? Malaria is a disease that's spread, like we said, by mosquitoes. So when that person is bitten, the mosquito transmits little parasites into that person's body. Those parasites then collect in the liver and mature there, and then they spread throughout the body, attacking red blood cells. According to the Mayo Clinic, the symptoms of this disease occur within 10 to 15 days after the bite. And then the person exhibits symptoms such as vomiting, headaches, chills, fever, and a few other symptoms. These symptoms are really similar to a lot of other illnesses, so it can be hard to diagnose malaria very quickly. But if the person doesn't receive the appropriate treatments within 24 hours, their condition can quickly progress into one that's highly fatal. When a person has severe malaria, they can exhibit these symptoms: severe anemia, hypoglycemia, acute kidney failure, fluid buildup in the lungs, and many other serious symptoms. Another scary fact about malaria is that it can remain dormant in someone's system for months or even years, and then attack seemingly out of nowhere. Luckily, there are some medications that are used to treat malaria. However, they are losing their power against this disease. The World Health Organization has pointed out a recurring problem of anti-malarial drug resistance. So basically, these parasites are evolving to where the drugs that are currently being used to fight malaria are ineffective against them. This problem is difficult because it requires a constant research for new methods of fighting this disease, which costs time and money. However, there is some great progress being made in the area of prevention. Insecticide-treated mosquito nets are being given to lots of the people of Sub-Saharan Africa, and these mosquito nets protect people when they're most vulnerable while they're sleeping. Also, this is a time when mosquitoes are most active at night, so it really has helped cut down on the rate of transmission. But they're not a great long-term solution. They serve as more of a band-aid over the real problem. There have been, however, some great medical advances recently, such as a vaccine that will be available in 2017. The World Health Organization has released this statement about their clinical trials. They say, the clinical trials results show the vaccine offers only partial protection, preventing 1 in 3 cases of malaria. So this isn't quite the news that everyone wants to hear, but it is good news, and it should offer some relief to those suffering with malaria. So many are being made aware of this issue, but there's still a lot of work that needs to be done. But the momentum is building, and it's time for all of us to join in the push. We don't just have to propel this cause with our money. There are other ways to help as well. People need to be made aware. A lot of good can be generated from a buzz that gets started amongst people. The key is getting the world's attention in small things. Each of us can take the time to talk to people about this issue, or tweet about it, or share pictures or stories of people affected with malaria on their Facebook pages, or write about their feelings in a blog, or even write an article to be published in a magazine or newspaper. There are so many different ideas. They really are endless, and the effects of these small things can be way more far-reaching than we could ever imagine. We don't have to stand helpless as we watch millions of people suffer. Each of us has the power to help. It just requires us to reach outside of ourselves. Albert Einstein once said that a person starts to live when he can live outside of himself. I believe that. And all I ask is that each of us takes a few minutes to think about ways that we could help others become more aware of this issue, and then do it. Thank you so much for listening. I hope you have a great night. Bye.